I'm Andrea Wagner McDonnell, and I am the Oncology Nurse Specialist for the Inpatient Leukemia, Lymphoma, and Multiple Myeloma units at Hackensack University Medical Center in Hackensack, New Jersey. And I am here at the Oncology Nurse Congress in Denver to talk about our project where we utilize technology to create an oncology portal to centralize institutional and education resources. And I'd like to thank the other oncology nurse specialists and educator who helped me with this initiative. But as we know, oncology nursing is a specialty, and it's a specialty that is forever changing with new treatments and protocols. And as oncology nurses, we do our best to keep up with all this information, but there is time where we have to utilize our resources in order to give our patients answers and to treat them safely. So when I started this position in Hackensack a little over 2 years ago, I started to notice that nurses were having trouble finding their resources, whether it was institutional resources such as policies or medication guidelines, or resources that we can outsource such as chemo education for nurses or for patients. So when my colleagues and I took a step back, we realized that all these resources go across various platforms, and there was really a need to streamline these resources into one spot. And that's really where the idea of the oncology portal came from. It's a website that's a one-stop shop for all of your resources that you would need. So we met with IT in May of 2024 to start building the oncology portal. And for us, how we built it was by using a Google site. So just to note, Hackensack is a Google institution. So by doing a Google site, we are able to maintain authorization and keep our Hackensack institutional policies within our Hackensack network, which was important to us. Once we had our domain, we started to build the oncology portal over 2 months. And what we created was one main homepage and 8 subpages. And the homepage features kind of like the what's new information for nurses to know, as well as institutional links and some fun things like featuring a new staff member every month so we can get to know our colleagues, and a weekly certification question. Looking at the subpages, our first subpage were links to frequently used oncology and Hackensack policies. So this way the nurse was just very quickly able to click on a link to take them to that policy. We then move into our largest subpage, which is our education subpage. And this is divided into many different parts. So our first part is chemotherapy education, where the nurse can go to trusted sites such as ONS to find information on chemo for themselves and for the patient. And then we also have another sub-page to that page, which is clinical education, which basically houses all education outside of chemo. We also have pages for every quality metrics with education for that. We do have another subpage, which is our clinical education and specialist resource page. And this highlights all of our clinical educators and oncology nurse specialists with contact information and their schedule. So if nurses need us, they always know who's here and how to contact us. We then have an oncology competency and classes page, which has links to all of our oncology continuum education classes, as well as the most popular Hackensack classes. Moving on, we do have an admissions page, which lists all of our direct admissions for the upcoming weeks. So nurses have quick access to that information when they need it, especially our charge nurses. We do have a coverage and directory page, which has our provider coverage for the month and our oncology curriculum directory for quick access to numbers. Our last subpage is our unit subpage. So each unit does have their own subpage for unit specific information. We launched the oncology portal on July 1st, 2024 to our oncology continuum, which consisted of 7 units. So it was 2 bone marrow transplant units, 2 oncology med-surg units, 2 heme malignancy units, and 1 urology kidney transplant unit. Since July 1st through May 1st, so about 10 months, we've had over 10,000 views, and we average about 1,000 views per month. We have over 500 active users with about 110 active users per month, and our average engagement session is around 4 minutes. Our top pages include our homepage, which makes sense to us because that's where you go when you hit our oncology portal link, but it also houses all of our institutional links as well. Our policy page, our clinical education page, as well as our clinical education resource page. When we think about limitations with the oncology portal, we think about maintenance. When we built the portal, we were very conscious to not have a ton of maintenance. We wanted this to be something that could live and the nurses could have from here on out. So we do have a weekly maintenance, it's about 10 minutes. And then we do have a larger monthly maintenance, which is about 2 hours, but it's still very manageable with those times. Since launching, the portal has had overwhelmingly positive feedback from staff, and nurses love it. And they also give us ideas to add to the portal, which has been very beneficial. Within Hackensack, we have presented the portal to other continuums and also to our outpatient center. And these continuums are also now starting to build their own portal. So I think it shows that not only within oncology nursing, but within nursing as well, it's very important that we have our resources readily available and easy to find for our nurses so that they can provide quality patient care.